everyone to today's IM session on spinal cord injury and the COVID-19 vaccine. This discussion is very important to everyone. It affects us all, and we must all do our part to make sure that our families and friends are safe. Today, we are presenting information so that you can make an informed choice for yourself and your family. I would like to first introduce our co-hosts and thank them for their dedication to the community. That is John Michaels. He is the Assistant Director for Resource of Independence, and Senator Serena Jarrus. She is our Independence Now COVID-19 Coordinator. Serena is going to take us into just some housekeeping rules. Serena?
Hi, I'm Serena. I'm the COVID coordinator. I will be minding the chat today. Oh, and no, we are recording. And this will be up in a few days on YouTube. I will be minding the chat. If you guys have questions and comments, when there's time, I'll ask or let people know. For those of you who the chat is not accessible, you can email me. I can just say it. Should I say it out louder? But yeah. So my email is sjaros@innow.org. And I can put it in the chat, but perfect. So yeah, that's in the chat. If you want to ask a question or comments, I'll get on that. So.
Thank you.
Oh,
Serena.
and I'm introducing.
Remember,
I was going to introduce. I'm done.
And remember, if you can please just wait until the very end to ask your questions. And if you don't feel like you have the time or want to email Serena, you can just take yourself off mute to ask your questions. So we're going to move forward and get things started. Today we have Ian. Ian Bruder is the editor of the New Mobility magazine, the longest running and most read publication for active wheelchair users. He joined the rank of active wheelchair users 23 years ago when he sustained a C5 spinal cord injury in a rollover vehicle accident. His background is in journalism and a passion for uplifting the voices of the disability community. Ian lives alone in Portland, Oregon, where he can often be found trying out the newest restaurants, my kind of guy, and food carts and exploring the Pacific Northwest. Ian, thank you for joining us. He is going to talk about his experience with the COVID vaccine.
Hey, thanks so much, Shannon. It's a pleasure to be here with you guys. I'm going to try and share here again, and hopefully this will work. If it doesn't, let me know. Let's see. Made a really simple PowerPoint. I'm probably the least qualified person on this call, so I want to be respectful of all the people with way more credentials and more to say than me. But I do have a couple things I wanted to share about my own experience, and then because I'm the editor of New Mobility, we were able to put together a real brief survey, and we got a pretty good response from just under 400 people with spinal cord injuries who have or haven't had the vaccine. I thought there were some interesting takeaways from that to share too that might help frame the discussion. So first, a little about myself. Like Shannon said, I live in Oregon by myself. I'm a C5 quad. I'm in a power chair. For those of you who can't tell, I've got my handy little cuffs going and rolling around. I've had both doses of the Moderna vaccine about 2 months ago now, and personally didn't have any response to either of them. The shots were below my level of sensation, and I didn't even feel it, to tell you the truth. My arms never hurt. I didn't have anything else beyond that. So that's my own experience. And I've been lucky, knock on wood, to stay healthy. So God bless for that. I've talked to a lot of people through the magazine prior to doing this survey about their experience with the vaccines. People get a lot of feedback. And the overwhelming majority of them, I think, would say that, aside from sore arm or maybe feeling pretty lousy the second day, especially after the second shot, that they've had very minor reactions. But doing the survey has been enlightening to see some other responses and to see kind of the breadth of the experience. So that's just kind of what I wanted to share here. I put up the website for those of you who don't know. New Mobility is www.newmobility.com. I do encourage you, if you have time or are interested, to go there and check it out. We've been doing a lot of coverage throughout for the spinal cord injury community. So let me move on.
Hey, Ian, since you're talking about my hometown, this is Mike Bullis. You're talking about Portland. What part of Portland do you live in?
I'm in Southwest Portland.
All right. Well, you're in my hometown, so
there you go. Excellent. Yeah. So we did this survey, and as you can see here, we got 367 total respondents. And 82% of those had received 1 or 2 doses of the vaccine. So a pretty good number of people that we're talking about here, a lot of varied experience. We asked just very straightforward questions. 72% of the people who had been vaccinated said that they had concerns about the safety going in or even after having that. And 78% of the people who hadn't received a vaccine yet said the same thing. So overall, it's about a little over 70% of people with spinal cord injuries. And I'm going to get to some of those concerns in a second, but just the high level stuff here. Only 60% of all 367, so about 223, said that they felt that they had accurate and enough information about how the vaccine would affect people with spinal cord injuries and disorders, which I thought was interesting. I think it speaks to, there maybe could have been more education going in to help people understand what this really means for our disability and kind of the things that we deal with. But to me, I think maybe the most interesting of the simple takeaways was that while 60% of the people who received the vaccine said that they had some reaction, an overwhelming 94% said that if they needed to have another vaccine or another shot in the future, they would be willing to do it. So, despite some of the reactions and symptoms and stuff that people felt, I think there's the people who did go through with it felt pretty good about it. So real quickly, I want to move on here. This was some of the comments, and I just put these on here. You guys can read them. I'm happy to share this if you want to distribute it later for people who want to look over it more. I'm not going to go over all these. But about the concerns, I tried to pick out a few. We got hundreds of responses about this, but there were more about specific for spinal cord injury. I feel like I'm that 1 in a million something bad would happen to. I wish there'd been a place that I could ask spinal cord injury specific questions before. I feel like people with disabilities were left out of the clinical trial process. I didn't see any mention of spinal cord injury when I was reading about this stuff, so I didn't know if it was safe. I had concerns about how it would affect my respiratory system. The information on drug interaction with some of the drugs that I take is sketchy. Just some of these are from people who did get the vaccine. So, and then this slide shows from people who didn't get the vaccine or have not yet got the vaccine, some of their concerns, which were a little different. Worried about blood clots, that it wasn't tested enough on people with spinal cord injuries. I've already had the virus. Why would I get a vaccine if it has a 99.8% survival rate? The vaccine causes inflammation. I don't want to have to deal with that. It's only approved for emergency use. What does that mean? And these were things that were said multiple times. I just pulled out one here, but thought there was some interesting answers there. And then lastly, from the people who had a reaction, this is also, I think, telling. I spoke to a number of people with spinal muscular atrophy, and a few of them responded to this, who said that they had prolonged neurological pain and loss of function after the vaccine. That's when I say a number, that's 3 or 4 of the people. A number of them didn't have any, but I thought that was interesting. I hadn't seen that before, and they're still dealing with it. All those people said they would still do it again, but it was an unexpected side effect. the weakness and fatigue, more nerve pain, and some of the more common things, like weakness in your upper limbs, inflammation, blah, blah, blah. But yeah, a lot of different responses, things to be aware of. And then the last thing here, I just put a couple. These were answers from people who had not yet or didn't plan to get the vaccine. What could be done to alleviate your concerns about the vaccine? More direct SCI info, more anecdotal evidence from people with spinal cord injuries, which I think is what we're getting here. More time, more testing, and then learning about spinal cord injury experiences. So that's all I got. I just wanted to share that. I thought it was helpful and interesting to see sort of a broad swath from our community. And yeah, we'll pass it along to the next presenter to share it. And again, thank you so much for having me here, guys.
Thank you so much, Ian. And remember, everyone, we'll take your questions for Ian after all of the speakers have spoken. Our next presenter is Dr. Groah. Dr. Groah is the Director of Spinal Cord Injury Research Programs at MedStar National Rehab Hospital and Professor of Rehabilitation Medicine at Georgetown University. Dr. Groah, are you here?
I am.
Hi, Dr. Groah. So Dr. Groah, we have two specific questions that we wanted you to be able to answer. And one of them is, it all happened so fast that I don't know if it has been tested well with people with spinal cord injury. And the other one is, what are the most common side effects in general? And have you heard of any new or different side effects within the spinal cord injury community?
Okay, thanks. And thanks everybody for having me. So I will take I guess the first question first. It happened so fast, and address the safety, because that was one of the comments I wrote down from Ian's presentation as well. Because there was a comment that he put up there from someone who said, has the safety been adequately tested, or something like that. So I'm fortunate enough to be a part of the MedStar system, and because we're such a big healthcare system, we get a ton of data. And so I've had the benefit regarding COVID, especially of being able to see that data pretty, live and real time. So regarding the safety, we've been talking about this at a high level for a while. And in terms of the testing of the vaccines, so the testing of the vaccines was not compromised at all. And what the emergency use means is it means that it's put into action quicker. And in terms of the research end of it, the testing of the vaccine, the part that was cut short to accommodate sort of the emergency use was the long-term follow-up. So usually with vaccines, people are followed for 6 months or even longer. With these vaccines, at least the Pfizer and the Moderna, they were followed for 3 months for, adverse events, safety issues, stuff like that. But all the testing leading up to that point was actually the same or similar as with other vaccines. And I have slides here. I have some of our MedStar slides. I don't know if you want to see them, but you guys can kind of direct me. But I can tell you that with the Pfizer vaccine in particular, I think it was something like, it was a little over 37,000 people got that vaccine when it was in trial. And it was pretty equally distributed. Of course, half of those people just got a placebo. So they either got the vaccine or a placebo. And then it was pretty evenly distributed between males and females. So 37,000 plus is a pretty darn good number, especially to implement, this clinical trial so quickly. So just consider, it's just that, the more remote, long-term, more than 3 months effects that the FDA and the study investigators really didn't know about going into this. However, that's when it was approved in December. But, you know, we're learning more and more about that now. And that's why we're seeing, like, especially with the Pfizer and the Moderna vaccines that have been approved for longer in this country, you know, literally every week, every other week, you know, we're sort of getting updated numbers. Like, you know, a good example is a couple of weeks ago, the CDC put out because the Pfizer and the Moderna vaccines are similar, kind of mechanistically, they looked at them together, and what they found was this, as of about a month ago, 80% efficacy with those vaccines just after one dose. But now those numbers are even a little bit higher. So yes, it happened fast, without a doubt. But the good news is, in my mind, the clinical trials also happened fast, and they were really quality clinical trials. And the gap that we had in our knowledge when they got approved for emergency use, we're filling now with increased time. So I hope that answers that question. And however you all want to do it, Shannon, I mean, I'm happy to field questions now or at the end, however it works for you on that question.
I am late to this. My name is Chioke. What is this all about? Is this about injuries?
It's about spinal cord injury and the COVID vaccine.
Oh, well.
And if you have any questions, we'll take your questions at the end of the session, okay? After the end of the last person that speaks, okay?
And I'm sorry, Shannon, can you repeat the other question for me?
And the other question was, what are the most common side effects in general have you heard of?
So the most common side effects, and again, because the Pfizer and Moderna vaccines have been approved for longer, we've seen more people with those vaccines who have received those vaccines rather. And it's very individual, sort of on the spectrum. I've had a number of patients myself who really didn't notice anything much at all. The side effects are really very typical with what you're hearing sort of broadly across this country. So maybe some arm soreness, some fatigue, oftentimes, fatigue, arm soreness, maybe some fever and chills. What I do hear a lot is if people experience that, it's oftentimes this 24-hour period, and then they feel better, and then they keep going on. Oftentimes, the people who did experience side effects like those at their first injection will often experience them in their second injection. That's pretty common. And oftentimes they might even be a little bit worse. I do want to point out too, so those are kind of the typical side effects for the COVID vaccines. I have not had anyone come to me, and I haven't heard like sort of written up from the literature or anything. So Ian, thank you for sort of that survey data. That's actually very, very interesting to me. I haven't heard anyone tell me they have problems with nerve pain or increased nerve pain. The weakness and fatigue doesn't surprise me so much because I think that is sort of commonly seen. And what I've also seen is, for individuals with spinal cord injury especially, I think if there's anything that sort of keeps people down, even for a day, 2 days, 3 days, and keeps you from your active lives, I feel like the implications functionally tend to be greater. So I kind of wonder when I heard that if the weakness and fatigue are going hand in hand with a period of bed rest too. But those are the common symptoms that I'm seeing from the vaccine itself.
Thank you so much. And like I said, everyone, if we can just wait, probably be another like 10 minutes with your questions. John, you want to take over from here?
I will be introducing Dr. Sheehan and Dr. Stone. First up, we have Dr. Sheehan. Dr. Sheehan is the Chief medical officer at Adventist I can't get the word out. Healthcare Rehabilitation and Acute Rehabilitation Facility, and specializes in traumatic brain injuries, spinal cord injuries, strokes, amputation, orthopedic injuries and surgeries, and neurological disorders. The two questions that we had surveyed for Dr. Sheehan is, my body has already been through so much that I don't want to have to go through whatever the vaccine might cause. And a close friend of mine was hospitalized after receiving the vaccine, and that scares me. Dr. Sheehan, would you like to answer those two questions?
So it looks like, John, I'm scrolling through, it looks like we don't have Dr. Sheehan on. You want to go ahead with the next doctor?
So then we'll just move on with Dr. Stone. Dr. Stone is a disease and infection specialist, Forbes senior contributor and scientist journalist. She is the author of Conducting Clinical Research and Resilience, One Family Story of Hope and Triumph Over Evil, her family's history of rebuilding their lives after the Holocaust. And the two questions we had for Dr. Stone was, will the vaccine cause blood clots or breathing issues? And your thoughts with the Johnson & Johnson vaccine? And can you tell us the difference between a live virus and the mRNA? Dr. Stone?
Me unmute.
There you go.
Things I have to do to see you, John. Who I've known for 27 years, you said? Something like
Pretty close,
that.
yeah.
Pretty amazing. So if you pull up the first slide, I wanted to show you a couple of things as background so you understand the vaccines better. So this is what the diagram of what a COVID-19 virus looks like. And the main thing to note from this is that it has these little spike proteins on the outside of the virus. And that's how the virus attaches to our cells. And inside you have a gene for the protein. Next, please. So the way this works with mRNA vaccines, which are Pfizer and Moderna's, is they figured out how to isolate the messenger RNA from the rest of the virus, and they use that they put that in a lipid, a fatty container to protect it, and it enters the cell that way. And the spikes, once it's in the cell, the protein, the mRNA, is activated and makes these little spikes that you see on the top of the circle. These proteins combine and make a spike, and they go to the outside of the cell, just like you saw previously. And those spikes then are recognized by our immune cells and are what is how we make antibodies and prevent us from getting infections. Now, one of the things you see here is that the key take-home message is that the mRNA vaccines, none of these vaccines actually can give somebody COVID. They're not alive. They contain a fragment of protein, a fragment of RNA in this case, that codes for making the spike protein alone. So nothing alive, nothing that can give you COVID. Next, please. The adenovirus vaccines are Johnson & Johnson and AstraZeneca, and they're both similar, although they're based using slightly different kind of adenovirus, which is related to the common cold virus. And here parts of the virus, the red squiggly things that you see, are inserted into the adenovirus to deliver it to the cell. And once it's in the cell, again, the virus injects its DNA, which then is translated to mRNA and makes the protein, the spike protein, which goes to the outside of the cell. So again, there's nothing live, there's just a fragment of protein. Hopefully that helps you understand a little bit about the differences in the vaccine and how they work in this case. So the main thing I wanted to emphasize to you are the question, go ahead, are the question about your concerns about safety and clots in particular, because there was such a brouhaha over the Johnson & Johnson vaccine, over there being a hold put on it because of 6, now 7 cases of unusual clotting that we're seeing worldwide. These vaccines are extraordinarily safe. I shared concerns when they first came out because there wasn't enough data for my liking about autoimmunity in particular, and unusual patients who may have some predisposition to having side effects. But now we've had millions of people tested. So if you're worried about clots, the risk of a clot from the vaccine translates to 1 in a million. That's not very high, okay? The risk of you getting struck by lightning is 1.3 per million. Of getting a clot from smoking is 18 per million. Of getting a clot from COVID infection is 165,000. Of getting a clot from birth control pills is 500 per million. And that's similar to the risk of pregnancy. It may be higher than that for birth control pills. Want to worry about dying? Worry about gunshot deaths. It's 10,000 per million overall, and 25,000 per million die among Blacks from gunshot wounds each year. Just by having a spinal cord injury, many of you may already have had a blood clot in your leg. A few may have had a pulmonary embolus where the clot goes to your lung. But the risk of clots in spinal cord injury is 100,000 per million. So you can see it's much, much higher than the 1 per million for vaccine. Okay, next, John. So there have been more than 211 million COVID vaccine doses given just in the USA, and many, many more millions of doses given internationally. The death rate from COVID infection is about 2%. The other risk that people don't talk about much is, but is a major concern, is that of becoming what's called a long hauler, which has now officially been renamed PASC, P-A-S-C. So having your chance of becoming chronically ill from COVID is about 10%. So to my mind, as I looked about whether to take these or not, we now know far more than we did when they first came out. And as Dr. Groah said, they were well studied even before with large clinical trials, many tens of thousands of patients. But now we know even more, and we know that the risk from a vaccine is almost non-existent. I mean, it's really next to zero. A very rare anaphylaxis, and even that can generally be treated successfully. And the death, in contrast, from getting COVID infection is much higher. And that's from getting overall in the population. If you have a spinal cord injury and your breathing is impaired, your risk of death from COVID is going to be much higher. So I hope that puts the vaccine in perspective and shares with you why I'm such an ardent proponent of it for everybody who can get it. Thank you.
Thank you, Dr. Stone.
Thank you so much, Dr. Stone. Due to Dr. Sheehan not being able to make it with us today, Would any of the other two doctors be willing to answer his two questions? And the questions are, my body has already been through so much that I don't want to take it. I have to go through whatever the vaccine might cause. I don't want to have to go through whatever the vaccine may cause. And as a person with a spinal cord injury, like, that was a question that hit home. Like, my body is already going through so much with my daily living. Do I want to have to take this? I did, but that was still a question. Like Ian said in his presentation, there was a lot of questions, but we still do it because we know that anything is better than catching coronavirus.
Right. So that's the perspective people have to keep in mind. The reactions, and Dr. Groah can elaborate more, but the reactions are overall very minor. The only thing that I read about, and you may know more, is a small chance of autonomic dysfunction, depending, which is rare, following any injection.
Yeah, I'd be happy to comment too. Dr. Stone mentioned this, but this is really becoming a bigger issue. She mentioned long haulers. And it actually has a name beyond long haulers now. So this is people who have contracted COVID, who have, they may have been in the hospital, may not have been in the hospital because of COVID infection. But even if they were in the hospital and they've returned home, they continue to have some symptoms. So it has a name now, PASC. So I think it's post-acute SARS-CoV syndrome or something like that. And actually, I got a sort of lobbying letter this morning come across my desk asking me to sign on because, there are numerous people appealing for more rescue aid in this country, specifically targeting the problems long haulers are facing. So I think the question and the concern are real. I get that. I think I totally understand it. But I guess the way I would advise thinking about it is thinking about it in terms of time. What we've seen sort of across the board is if people are going to have some side effects due to the COVID vaccine, those are usually very short-lived. And those are getting more and more well documented. And really, there's a few people that have, reactions beyond 24 hours, but the vast majority are, sort of a 24-hour period, and possibly with both injections. But we're just learning now about long haulers. And I can tell you that, there's a lot of unknowns there, and it's frightening. I will say that at National Rehab Hospital, we run a clinic for post-acute SARS-CoV syndrome. And I will give you this statistic. First-time people who come to our outpatient clinic who have had COVID, and this is irregardless of whether they have an underlying disability or not, the average number of referrals to specialists at that first appointment is 3. That's just a ridiculously high number. And it's neurology. The common ones are neurology, cardiology, and psychiatry are the top 3, because what's emerging is there's a lot of sort of long-term sequelae of COVID infection, being neurologic and sort of psychologic, psychiatric. And then Dr. Stone had mentioned the autonomic. I think that's part of the reason that, and we are seeing autonomic effects of COVID itself, again, regardless of spinal cord injury or not. So I would think about it in terms of time.
Thank you. I just had a quick, could we pose questions from the chat, or do you want to wait for a little bit?
It's okay, Serena.
Okay, so could you explain, and this is general, what's an autonomic response?
So I'll be happy to do it if you like, Dr. Stone. Is that okay?
Sure, great.
Yeah, so the nervous system, there's multiple parts of the nervous system. We're used to hearing about the part of the nervous system that controls motor function or movement, and then the parts of the nervous system that control sensation or feeling. Other different parts. If we think anatomically, the nervous system, there's the brain, there's the spinal cord, and there's all the peripheral nerves that come out from the spinal cord. Well, there's another part of the nervous system that we often don't talk about, but it's actually gotten a lot more attention recently for a number of reasons, and that's the autonomic nervous system. So the autonomic nervous system is, again, a series of nerves. It actually comes from both the brain and the spinal cord, but it controls our autonomic or automatic functions. Heart rate, blood pressure, it helps with bowel and bladder control, sweating, getting goosebumps, that kind of thing. So what we've seen in terms of autonomic nervous system problems, which has actually been with COVID infection, so I'm not referring to the vaccine here. We've seen big ups and downs in blood pressure, just for no reason, and ups and downs in heart rate. And my guess is that, we're just in the beginning of learning about these autonomic effects. So I think more and more is going to pan out there.
So Dr. Groh, to piggyback off that, so persons with spinal cord injury normally sometimes will get autonomic dysreflexia due to something going on with their body. Sometimes these things send them to the hospital. Sometimes there's a hospital stay. What does that fit in with the vaccine? Have you heard of anyone with spinal cord injury going through? I've never had it, thank God, but I've heard that it can be very, very serious. So have you heard of anyone after the vaccine getting autonomic dysreflexia?
I have. So to answer quickly, I have not. So, I mean, 2 points that are really important about this. So the people who are at risk for autonomic dysreflexia, they generally have to have an injury around T6 or higher to be at risk for autonomic dysreflexia. That level of injury gives people an imbalance in their autonomic nervous system. The other super important thing is that whatever irritant causes the autonomic dysreflexia, it has to occur below their level of injury. Okay, so the actual physical getting the shot itself, like just the needle going in the arm, should not be an issue for the vast majority of people. There will be some people who have injuries higher than that, but that should not cause it itself. And I have not heard of anyone with spinal cord injury who's at risk for autonomic dysreflexia having any problems in that regard with the vaccine itself.
Thank you. Mm-hmm. So Serena, does anyone else have any questions? You can take yourself off mute if you want to ask a question.
We're waiting for Carlos. Terry Seitz put in the chat, board member at Image, that they had both Moderna shots with almost zero side effects. And as a side note, also worked on the National SCI hotline in the 80s and 90s and is very thankful for Sam's book.
And if I can say something, I actually,
I have a question.
Go ahead.
Yeah, with some of these shots and stuff, can it also affect people with gout? Because I know people with gout.
So both of the, and I'll start, and probably I'm guessing Dr. Stone probably wants to say something about this. I mean, the point of the vaccine is to stimulate an immune reaction. And so when, the whole purpose is to rev up the immune system. And that's why people feel those symptoms in the first couple of days after the injections. And then it calms down. So it's prepared if and when your body gets exposed to COVID. So the point is to rev up that immune system. Now, I haven't heard of, gout, which is an inflammatory condition, being exacerbated by this. But that being said too, I don't see a lot of patients with gout. So I don't know, Dr.
Don't? because my mom just got and I'm fully vaccinated, but she has gout and it runs in the family. My aunt has it and stuff, and people were flat-footed and stuff, you know.
Kioki,
Yes.
we've got some questions coming in specific to the spinal cord injury discussion, okay? So I'm gonna put you back on mute so that the other people can ask their questions about the spinal cord injury intersection with the vaccine, all right?
All right.
But any question, they should always speak to your doctor. Always speak to your doctor if you have any questions about any type of medications or other things that you're doing.
And I would just add, I have not seen anything, any reports of increases in gout. And what surprises me and reassures me greatly is that I've seen almost no cases reported of people with autoimmune illnesses feeling worse or having any flare-ups of that after the injection. Is that was my big concern, and just not seeing it.
Awesome. Are there any more questions, Serena?
Yes, this is from Carlos. I can read it aloud. I have a spinal cord injury, C7, and take a holistic approach towards my health, vitamin C, D, elderberry, and haven't been vaccinated. How will the vaccine correspond? With the vitamins, I suppose, and also just overall.
I'm assuming that Carlos is intending, how will the vaccine interact with the vitamins? I mean, those vitamins in particular have some functions to sort of keep your immune system strong, basically. So, there's no indications whatsoever, just kind of by what we know about other vaccines, what we know this vaccine, that there's any negative interaction. If anything at all, I would assume it would be a positive interaction to, just strengthen your immune system.
Miss Deborah has a question. You want to say it aloud, Miss Debbie?
I have a question. I received my spinal cord injury back in 2001, and unfortunately, they never were able to diagnose me, so they don't know where my spinal cord injury came from, because it was something physiological in my body, but they never could really determine where the spinal cord injury came from. It's in the T6 to the T9 area. But anyway, so I still have a spinal cord injury, and then on top of that, I have end-stage kidney failure, and I have high blood pressure, and I'm diabetic. So I have a multitude of serious issues going on. So how would that affect me, in your opinion?
Well, do you want to take that, Dr. Groah?
If you'd like me to, I'm happy to.
That's fine. I defer to you.
Okay, that's fine. My initial response is, if anything, I think some of those medical conditions would put you in the high risk category for COVID itself. Again, we have had in the COVID vaccine trials, people with hypertension, diabetes, et cetera, were in those trials, and there was no issues with those conditions. So, it would lead me to encourage someone like you probably more strongly to get the vaccine.
Right, I would agree with that totally. The one thing I would add is that because this came up with another patient, is if somebody is going to begin chemotherapy or begin treatment with prednisone for anything, they should try to get the vaccine a couple of weeks before they begin any immunosuppressant therapy.
Mm-hmm.
So I have another question. So is it okay, because I know I'm going to get the vaccine on Wednesday, the first dose, and I also have to take a hemoglobin shot on the same in the same day, but after I can get the vaccine, would that be a problem?
No, no, they just say, they encourage you not to take 2 vaccines at the same time, but
Mhm.
that again is out of the old abundance of caution and not based on any data.
All right, thank you.
This was great. And Dr. Groah and Ian, I'll be reaching out to you because I'm going to write a post on this on Forbes. So I'll have some more questions for you. Thank you.
Make sure you mention us.
I will. I will. But I'd like Dr. Groah and Ian to send me anything else they might want me to include in that. So I can call
Great.
attention to this. Thank you.
So, Serena, has anyone sent you a question by email?
No, we don't have any. I had a question for both of you. What is, I hear a lot of people say, I take supplements, I take vitamin C, I take vitamin D, I'm really taking care of my immune system. What's the vaccine maybe like offering that just taking those supplements or working out or eating right or whatever aren't doing for your immune system? Like, what's the motivation to go ahead and get
The vaccines are specific. They targeting that spike protein.
Mhm.
There are other things that may help in terms of your general health and well-being. And there are a lot of studies going on now looking at specifically vitamin D and vitamin C and many other common medicines. But the vaccine builds your immunity specifically against COVID virus. And that's why you need to get it.
Yes, my name is Mike Saunders. I have a question for Dr. Groh. I fit in that category of T6 and above that you were talking about. I'm actually a T6 paraplegic. And I had both shots. As of last Thursday, I would be considered fully vaccinated. So my question to you, is there some type of symptoms that things, because I had COVID in 2019, November 2019, when it first came, and I went to the hospital. They didn't even know what I had at the time. They just said I had a virus. The things that I went through, and I'm just sharing a little bit of this with everyone. The things that I went through at the time, the COVID, I mean, the way I was vomiting and doing things of that nature, I was a little concerned that, because when you take vaccines, normally they're supposed to, I guess, put it, whatever the inside of you, and then you fight it. So I was a little concerned that I would have some things like that happen to me once I took the vaccines, but I didn't. I did get the chills on the second one, was down and very fatigued on the second shot for about a day or so, a little day and a half. And I took a Tylenol before I went to get the shot and did a Tylenol after the shot of both of them. But my question is, back to what I was saying, is what you were saying, is there any symptoms to anything like that happening? Because I had, like, I would say when I first had COVID in 2019, something happened to me. And it was funny, I was like paranoid about a lot of things. And even using the restroom or whatever else, I was going through something. But since I've had the vaccine, it seems like those things aren't happening to me anymore. And I don't know if that is anything related to the vaccine or what I might have been receiving from a symptom from COVID.
And I think it's hard to say if the vaccine, I think that's what you're asking. Could the vaccine have positively impacted some of those symptoms?
Right. Yes.
And that's hard to say. I mean, I can't say definitively. I can say that I'm glad that the symptoms have resolved for whatever reason. And perhaps, part of what you were experiencing was some of what we're just learning about with the long haulers. that again, we're just in our infancy in terms of learning about that. But again, for whatever reason, I'm glad they've resolved.
Yes. Thank you.
So I want to say, I hope, this has brought the information to you guys that you needed to make an informed decision, because it's very important that we take action. We are a group of people that are advocating for people with advocating for people with disabilities every day. And it starts with us. So we have to be leaders and go out into our community and do what's best for us, our families, and our community. So I'm gonna leave it to John to close this out. And thank you to Dr. Groh, Dr. Stone, and Ian. Thank you so much for being here. John?
Yeah, I'd like to piggyback on things. I actually got both of my shots and totally have been vaccinated. And a couple of things that decided for me was when it first started, not taking it seriously, but I was I'm a very active person working 3 jobs. And when COVID started, I mean, everything come to a stop. And my fiance worked right on the front line of COVID. And so, we were very paranoid every day, her coming home from the hospital, of taking all these precautions for me and the aspect of everything that she saw, as in how people were responding to everything. And the first person I was reaching out to was Dr. Stone, because like I said, we've been a patient of hers and friend, and she's just been amazing with me when it comes to my spinal cord injury stuff. That whatever she says, it's like the Bible to me. It's like automatic, like that's what I'll do. And I've done that with her. And just to learn, like I was ready to get the shot right away, just because, for 27 years, I've advocated for myself and now for others with individuals with disabilities. And the last thing I wanted to know was I went out because of COVID and not out of this life in a different way. So that was not going to be, deter for me from that. And to know that maybe if I get COVID, that I would be able to survive just from some of the side effects. So if there's anybody that has any inkling or, wants about the shot, is that say definitely, from what the Dr. Stone and Dr. Grohl say, should and Ian have helped with your decision with that. And being able to have Dr. Stone now link up with Ian and Dr. Grohl to keep this going, and to be able to share other stories with that now. But I'd also...
let me interrupt for 1 second. You make an excellent point. The people who have the vaccine, basically nobody who has gotten the vaccine has died from COVID. You may get a mild case. A few patients are being hospitalized with COVID after vaccination or breaking through, but nobody has died. And that is a huge relief for me, and should be a bigger relief for you guys who are at more risk because of your breathing difficulties and injuries. Sorry, thank you.
Oh, thank you. So I would just like to share, I just jotted down a couple of things we wanted to still give a little awareness, that there's still many places you can sign up to get your vaccine. Definitely your local health department. There are many websites out there now that you can go to sign up for your areas. The coronavirus.maryland.gov, Maryland Vax, the ILRU.org project, COVID Link Maryland. There's many different places you can go to sign up. And then also you can contact any of your local CILs in Maryland of the region you live in. So I have this. If anybody would like copies of this, they can definitely be emailed. It's just quick thing I jotted down. So I want to share those as well, that you can still sign up. And then there is places that are actually walk-ups now, because they're not filling all the slots. So you can find those places as well in your area, all across the regions. So with that, we'd like to close out. And if there's any other questions or anything, Serena or Shannon or I can forward those on to any of the guest speakers we had today. So thank you for everybody that participated today for the IM.
And I'm gonna step in really quick because I know this is something that IM does every day, and we haven't every Monday, and we haven't done it yet. So if you have any events that you want to put out there, now is the time. If you're doing something that you want to share, Independence Now is having their vaccine clinic on Wednesday. So if you're in our area and you need to register, please contact me by email, and I can send that information to you as well. Katie just posted, we are hiring. Katie, you want to talk a little bit about that?
Yeah, so as we kind of shift our focus from, surviving COVID now to getting the vaccine, ARI is going to be hiring a vaccine coordinator, temporary full-time position, $20 an hour, starting as soon as I can get you hired. I put the link in the for the position announcement, and resumes should be emailed to me. And I think that's it.